And now Paris Gutsoyanis from the Scotsman.
Thank you, Cabinet Secretary. Can I first confirm with Professor Leach the comments that he made about new advice to the shielded category? So should we expect that that advice might vary for individuals with different conditions before the 16th of June? And can I also ask you, Cabinet Secretary, the First Minister said this morning in relation to the decision to move people from hospital to care homes that, quote, people who didn't have symptoms either because they were pre-symptomatic or asymptomatic didn't shed the virus. But the World Health Organization was advising as early as the 2nd of April that pre-symptomatic persons can be contagious. Yet the guidance didn't change to care homes until the 22nd of April. Can you square that at all?
Thanks very much. Jason, do you want to start?
So the shielded group has never been static. So the shielded group has always moved. So splenectomy, for instance, those without spleens, not in, then in. So we have always said that depending on the clinical evidence of who this coronavirus particularly affects and the high-risk groups, we will of course move people in and out of that. The shielding is not the law. Shielding is advice to protect individuals and families. So I would anticipate in the week and days ahead that we will make some adjustments both to the shielded group and to the advice to everybody inside that group, just as we've intimated. I can't tell you what that will be, but if the numbers stay down, I sincerely hope it will be to enable them to do more than they have presently doing, because, as we've said, I worry deeply about that group being in their homes for all this time.
And in answer to your second question, as we've said many times, I and indeed the First Minister benefit from advice from a range of individuals in terms of those who are scientifically expert in this, what the World Health Organization said, from our very senior clinicians and through that advisory group that the Chief Medical Officer convenes, as well as what comes to us through SAGE and by other ways. And so at the time when we made the decisions we made based on the information and the advice that we had at that point, bearing in mind that we have never said anything other than, as politicians, we are the ones who are accountable for the decisions that we make. But I also need to remind everybody that on the 13th of March, we issued very clear guidance to care home providers that was designed to protect their residents. And that guidance was about residents spending a significant amount of time in their own room, the ending of communal activities, including communal dining. We stepped in to ensure that PPE that had fallen over from those private supply chains was picked up and supplied by us through our NHS stock. We, on the 13th of March, said you need to end visiting, except for those exempted circumstances where someone is at the end of life or the resident has particular distress from perhaps dementia about the other restrictions that we want you to put in place. And you need to prioritise your infection prevention and control. All of those measures are central to ensuring that you prevent the transmission of the virus. Now, since then, of course, we have increased the level of testing, including for patients who are discharged from hospital into care homes, both those who have been in hospital for COVID and those who have not, as well as testing for care home workers and residents in care homes where there is an active case, care home workers across all the care homes. Remembering too that care home workers and social care workers have also always been the #1 priority, along with NHS workers, for key worker testing. So as I've said, those were all the steps that are really clearly laid out that we have taken, and in the fullness of time, that look back at all the decisions we made as a government in Scotland, as governments made in the rest of the UK and wider, will all be looked at with all the data and the information that people have to hand at that time against what was to hand at the time. and we will not only understand how all of the journey of the pandemic was undertaken, but we will, I am certain, learn lessons for the future.